Hi friends, everyone. Yeah, this is Dr. Muragijeyesu, also known Dr. Ernest. Yes, I have got my results, and I have for COVID-19. I have positive results for COVID-19, and so it was actually yesterday, before yesterday on 23rd. That's where I got my results, and yeah, I thought. I should just, these few days, share my journey, what I'm experiencing, and how is it going, and also since I'm just gonna be isolated for the next few days or so, I thought I can be making some videos and sharing how I'm doing, but also sharing the lessons that I learned about this pandemic and yeah, so but even more important, I know the fear, legitimate fear, by the way, that is out there. People are so afraid, but some are also afraid because of a lack of information, so to speak, because once you know, at least it reduces a little bit of the anxiety and stuff. And yes, it is not to downplay it. I also don't know even how it's gonna go with me. This is actually my day to post my results. I know it has affected a lot of people. It has affected people close to me. I know people that have passed away. So this is very serious. Of course, we don't mention what it had cost us economically and our freedom of movement and so on. So this is very serious problem, and so while I still okay now, I thought, why can't I just come and share my experience and also to make it it's not a I know when one gets it, some are even afraid to mention their diagnosis because they fear how they're going to be victimized in a certain way. But the more we share about this and the more we share what we know, the more we can comfortably be able to tackle this. Anyway, so we are here at Dr. Mura Health. I'm going to be sharing a couple of videos for the next few days that I'm in isolation. I thought I'm isolated anyway. I can be sharing some lessons that I learned, and also sharing what one can do in this for those that haven't been infected yet, but also those that have been infected, and what we can be doing to to optimize our health and to increase the odds of fighting this virus. So stay tuned. There are going to be a lot of specials as well as we go through this. But first, yeah, so of course, most of you know, I'm a healthcare worker. I work in Department of Anesthetics, and so we deal with the airways at regular basis. That's what we do basically. And of course, all the hospitals, even my hospital included, they try to do the best that we can to screen patients that are coming in and trying to isolate and those that are suspected to be isolated and so on. But again, I personally don't know where I got it, but invariably something had happened. But briefly, what happened is my brother first got sick, and so again with he had a fever, I started having coughing, headaches, and general malaise and so on, and so I decided to take him for a test, and the result came positive. So having been with us, there is contact with everyone in the family, so we decided to go and test as well. And so my results came positive, like I mentioned, I think on 23rd, just a couple of days, 2 days ago. And our help as well, the result came positive. My wife, surprisingly, just came in. She's negative, and I do pray she stays that way. Of course, she had to be totally isolated from the rest of the house because most of us in the house are sick. But I also think that she tested a bit early. So after 5 days, she will have to retest again to see where we are. Of course, it's a concern. Our young kids, one my son turning 5 and my daughter turning 3. Of course, they have been exposed, and of course, you know the kids. They come jumping on you everywhere, and also having been with our help at home, who's also positive, they definitely got this virus. But just to say that the kids are fine. They are healthy. And as for me, if it wouldn't have my brother who got sick, I wouldn't even have known that I have any problem at all. Because I didn't have any symptoms, just not at all. I'm not coughing, I'm not no fever, nothing. Just of yesterday, again, the symptoms, things may change, of course. This is early stage. That's what I can tell you now, what I still can. But just of yesterday, the only symptoms, the only thing that I had are just mild headaches, nothing serious. And I haven't been able to take anything for that. Yeah, so basically that's all we had, and so I'm going to be we're going to be isolated a bit for a couple of days, away from everyone. But yeah, so I thought I should come in and check. I know a lot of some of my colleagues who was down with this virus, and I'm sure almost everyone now knows someone who have come down this with this virus. And yeah, so just what I want to say is do the best you can. Let's follow the few regulation or guidelines that our government, our health department put in place. And I have actually a few things that I can mention for those that are. I didn't mean this video to be long. I'll be coming tomorrow with more on this pandemic, but generally, a few things. If you have come down with the coronavirus, number one, it's something that we all know, I'm sure, but it's worth repeating this because in doing this, taking these precautions can save other people's lives because this is a very devastating disease and it hits very fast, very hard, and sometimes we even our healthcare workers, we don't have solutions. I mean, there is no cure. You know that there is no cure, and what we do is trying to help with the symptoms, and but generally, so far we have no cure. And by the way, even if I know we talk about a vaccination coming and stuff, but I don't think we're gonna have vaccination anytime soon. And even if it was, I mean, the vaccine, you know, the failure rate for vaccines, they are 96% failure rate. So even if there was such a vaccine for COVID-19, it's not something to certainly be excited about. But anyway, so number one, self-isolation. Once you know that you find this result, self-isolate. Basically, or quarantine yourself. This is to prevent infecting others. It's very, very important. And because now you're sick, but you can do much, much more to help preventing other getting sick. The best way to stay at home and stay from public places. And also, if you have to go outside to get essential like food or medicine and so on, don't use a public transport. If you have a family who's away, who can buy those things for you and drop them, that would be the best idea. Or now you can even shop online and the things can be dropped for you. But generally try to to prevent going outside. But if you have no other ways, you have to go outside. Trying to, if it's possible, I know it's not easy, but trying to use your own private transport, use your own car, and wear face mask to try to prevent others from infected. I know that is not easy, but that's one of the things that should be done. The second thing that one needs to do, you need to monitor your symptoms. That is to monitor your temperature and monitor you. How is your coughing? How are you breathing? If you start, if you start, if you think that your symptoms are getting worse, such as you have a trouble breathing, you have chest pain that is getting worse, or if you basically, if you feel, you see like maybe your lips are becoming blue or your face becoming blue, try to not delay. I understand there's fear out there, and some people, they think actually we're killing people in the hospitals. They say rather die at home than going to the hospital. But you have to understand that often people die. Of course, we. If people have come to the hospital, of course they die. But it's not that we're killing people. It's often people present late, and it may be a little bit later to start to help with the symptoms and to try to save their lives. And so far, if there's any consideration, is we know that basically majority of people do get better, they do survive. But of course, some that are having some other modified conditions, they may have to be even more vigilant, more careful to alert the healthcare provider when the symptoms start getting worse. People that are having type 2 diabetes, hypertensive patients, those that have cardiovascular diseases, obese people as well, and those that are having underlying respiratory disease such as asthma and pneumonia or COPDs and so on. Those should actually be alerted early. If you actually have a means to be best to monitor your symptoms with using like a pulse oximeter, or to check the saturation or how you're doing. And of course, for you monitor your temperature, like I mentioned, and other symptoms that get worse, you need to report as soon as possible. That's number two. The third thing that I think is very, very important: get some rest. Get some rest. That's what I'll be doing most of the time now. Get some rest and stay hydrated. Drink enough fluids. Again, it's not I think this shouldn't be a good time to just drink all the fizzy drinks and all the high processed sugary things, and I'm gonna be talking about that, how that may adversely affect you. But just drink enough water and eat nutritious foods, eat healthily, and we talk about that in the coming videos as well. That's number three. Number four, I think, again, this is not an exhaustive list, but a few things that I think if you have come down with the COVID-19, you should be focusing on, you should be doing. I'm sure there are a lot of things, but number four, again, even yes, you have isolated yourself, and but invariably now it's not easy. We are privileged to have a bigger house where we can isolate so many people, but I know it's not feasible for most of people. So you may just have only the small corner in your house that you can be as isolation, not even the room. So please keep covering your mouth when you cough. Use a tissue and thrower, or just how you cough, your elbow. Keep your mask on. It's very, very, very important. Number five is something that you heard over and over. Wash your hands regularly after touching things. Wash your hands with the water and soap for 20 seconds, or you can use alcohol-based hand sanitizer. You need to check if that hand sanitizer alcohol content is above 60% alcohol. Yeah. So, and number six, which is very important, is also again, I mentioned to stay away if you can. Specifically, have someone who is sick should stay in their own room. they should have their own bathroom, they should have their own toilet, and you should try not to share any utensils, including dishes, including towels and beddings and stuff. That's is very very important. Number 7, I think I just added to that. Number 7 will be is to say that I think I mentioned it, to stay away, use your own separate things, and something that is very important is number 7 is open. If you are in the room that have windows, open them. Getting air coming in and out is very important and can decrease the viral load in the room as well. And importantly also, number 8, they say it also is being found that in dry air, if you use some humidifier, can actually cut down the viral load of the virus, which is very important. Now the last thing, which is number 10 again, I don't even know what I'm talking about this, but if you have if you have to be in a house where you don't have isolation room, and you may need to keep wearing your face mask. And by the way, face masks are meant to prevent you from infecting others, not other way around. And this is where not only you should, this is why I think we should actually wear the mask, because I didn't know that I was sick. Had I not tested, I wouldn't have known that I'm sick. Of course, I've been always wearing a mask, and this shows that you may feel fine, but doesn't mean that you shouldn't wear a mask, because you may be fine, you may be asymptomatic, but it can be still infectious. So please, if you can, wear the mask. And I don't know if you've been in cold weather. Now research are finding out things like human coronaviruses, influenza, and rhinovirus. They can actually be detected in a breath, basically. So that's the reality. And I don't know if you've been outside in a cold day in the winter, not even the winter, and as you exhale, you can see the vapor of that a cloud of vapor. So that is made by some respiratory droplets, and that basically comes from out of our lungs. And if you're infected, if you breathe and out, and that's how basically people are catching it now. That's why it should be we should wear a mask. Anyway, I think it's getting too long. I didn't mean to take too long, but I just want to come in and to talk to all those that have been affected, that they let's say keep our heads up and have some rest, do the precaution that we can, try to prevent others from getting infected. Spend some time now virtually with our loved ones, to limit our stress, so that we're not lonely and get even more sicker, and let's stay positive. So that's it. Thank you so much. Please, your comment and some questions on the below, and then I'm going to answer them. But we continue tomorrow. Tomorrow I'll be talking about what can I do, what can you eat, or rather, as people keep I've seen so many things. People talking about what I'm eating. They are talking about what to do for strengthening your immune system and so on. But we talk about it tomorrow to see what does science say today about strengthening your immune system. Are the people that are getting sick because the immune system is low, or what is really going on? We talk about this tomorrow. But thank you so much, and stay safe. Thank you.